we're going to go ahead and get started with our webinar today. I would like to welcome you all to our webinar, Addressing Chronic Absenteeism through ESSA. We're excited you all could join us and hope that you enjoy our webinar today. My name is Alex Mays, and I am the National Program Director of Healthy Schools Campaign, which is the organization that's hosting today's webinar in partnership with the Alliance for a Healthier Generation and Attendance Works. I'll be moderating today's webinar and just wanted to start us off very quickly by reviewing the logistics for today. So our webinar is going to run for about an hour, and we will have a recording of the webinar and slides that will be available to view after the webinar. And we will be sending out an email with a link to that recording and the slides within the week, so look out for that. We also have a very quick survey at the end of the webinar. We want to hear your thoughts on the webinar and have you share any additional information related to today's topic, so please look out for that. We will save time at the end of the webinar today for the question and answer session. So after you hear our speakers present, feel free to type those questions into the question box, which is on the control panel on your screen, and we'll be collecting those questions and saving them for the end of the webinar during our question and answer session with our presenters. So we have a wonderful lineup of speakers joining us today. We have Nancy Brenowitz-Katz from the Alliance for a Healthier Generation, Sue Fothergill from Attendance Works, and Lori Paisley from the Tennessee Department of Education. So on the next slide, you'll just see our agenda for the webinar today. And so we're going to have a review of ESSA. Oh, whoops. We're going to have a review and overview of ESSA and the opportunities for supporting school health and wellness. Go deeply into the opportunities ESSA presents for addressing chronic absenteeism. We'll speak a little bit about the health-related causes of chronic absenteeism and why chronic absenteeism is such a strong proxy for school health and wellness. And then we're going to hear from Lori in Tennessee, who's going to speak more about how chronic absenteeism was incorporated into their state ESSA plan, and how they see that leading to future action and efforts. And then, as I said, we'll save the end of the webinar for a question and answer session. So without further ado, I'm going to introduce our next presenter, who is Nancy Brenowitz-Katz. Nancy's the Director of School Partnerships for the Alliance for a Healthier Generation. In this role, she builds and maintains cross-sector relationships with key national and local government agencies and non-governmental organizations. And she also leads the organization's work around the Every Student Succeeds Act. Prior to working at the Alliance, Nancy worked as the manager of Healthy Schools Act initiatives at the Office of the State Superintendent in Washington, D.C. For 10 years, Nancy also served as the Dietetics Program Director at the University of Maryland, where she trained hundreds of students who went on to pursue careers in dietetics. She's a registered dietitian with a master's degree in nutritional sciences from the University of Maryland. And I would just like to thank Nancy for joining us today and the Alliance's partnership in this webinar and our work around the Every Student Succeeds Act. So Nancy, I will now hand it over to you.
Great. Thanks, Alex. Can everyone hear me okay?
Yes, we can hear you loud and clear.
Okay, perfect. Awesome. Thank you so much. So I'm so glad to be here with you today and this great panel of speakers to talk a little bit about the Every Student Succeeds Act and chronic absenteeism. And so we've been lucky enough for the past year or so to be working with Healthy Schools Campaign on work related to the Every Student Succeeds Act and helping to encourage states to consider health and wellness as they're putting their ESSA plans together. Many people are familiar with Alliance for a Healthier Generation. Our goal is to make sure that the environments where kids spend their time support and promote good health. So a lot of that work is focused around the school and out of school time space, but we also do some work on state and federal level policy, as well as work with the business sector and the healthcare industry to ensure that all the different sort of sectors that are touching our children's lives are helping to prevent obesity and promote good health. Next slide, please. So I'm going to give an introduction to the Every Student Succeeds Act. The Every Student Succeeds Act was signed into law in December of 2015 by then President Obama. And this was a really nice opportunity. Some changes took place from the previous law, which is commonly known as No Child Left Behind. And I won't go into all of the changes here, but it really did offer a lot of opportunities to think about health and wellness and think about ways to really integrate health and wellness into more of the sort of educational structure that schools are responding to. So next slide, please. So there are lots of opportunities throughout the Every Student Succeeds Act. Oh, and I should say that in any good conversation about the Every Student Succeeds Act, the question comes up whether it's ESSA or ESSA. And we've asked lots of people that same question, and it sounds like either is fine. So if you're referring to it as either of those, you're fine, and you'll probably hear us refer to it interchangeably throughout this webinar. So there's no correct answer on that one. So that's a good note for today. So in terms of the Every Student Succeeds Act, it's obviously a very lengthy piece of legislation, about 1,300 pages. So with help well, I shouldn't say with help, the Healthy Schools Campaign did an excellent job of really perusing through that long piece of legislation to figure out where are the great opportunities to support student health. So within the law, there's lots of different sections of the law, but these are the three areas where we thought that there could be great opportunity to support health and wellness. So Title I covers the funding to states and school districts with high percentage of low-income children, and Title II is the professional development title. And then Title IV, we'll talk a little bit more about each of these later, but Title IV is where the student support and academic enrichment grants exist, and also community support for school success. So there's some grant programs within Title IV where the money could specifically be used for student health and safety. And there's also money there that supports things like Promise Neighborhoods and community schools and 21st century learning, which are, efforts to really address the whole child and make sure that kids have everything they need to be academically successful. Next slide, please. So we did develop, along with the Healthy Schools Campaign, this framework document, and the website, the web link is there for you in case you would find this resource useful. And so this really outlined our vision of, where throughout a state ESSA plan would health and wellness, or could health and wellness be supported ideally. So each state is required to submit a plan to the Department of Education. There were 2 due dates, one just passed and one is in September. So actually the majority of states have not yet submitted their plans. So we're starting to see some of the different approaches that states are taking within ESSA, and chronic absenteeism has certainly risen to the top as one of the metrics that many states are going to be using, which is thus the purpose of this webinar. But there's still a lot of opportunity to get involved. So this framework is really sort of a guidance document. If you wanted to get involved in your state and support health and wellness through ESSA, where would you even start? Who are the partners? What's the language? Where are the right places to go and talk about this topic and get to the decision makers? Next slide, please. So again, there are numerous opportunities within ESSA in where health and wellness could be incorporated. So the first is in the state accountability system. So states are required to have a system in place whereby they're looking at their schools and holding schools accountable to certain metrics, and that's sort of how they define is a school successful or not. And then schools that are designated as not successful, sometimes that's referred to as being in need of improvement, have to be given support in order to come up to an appropriate level. So this time with ESSA within the state accountability system, for the first time ever, states were asked to include a metric of school quality or student success. So that was really the Department of Ed's attempt to really start looking at some of the other factors outside of simply the academic factors that could be impacting student success. And this is an area where a lot of the states are going to use chronic absenteeism as that additional metric. And so looking at all of the factors that impact chronic absenteeism is very important. The next place is within the state report cards. The state report cards are basically the public accountability system. So it's information that states are required to put out to the public about all of their schools. And so encouraging more health and wellness data to be included on those report cards encourages schools to kind of beef up their health and wellness initiatives, and hopefully also allows the state to provide support to schools in order to do that. We mentioned that schools are sort of designated as needing improvement if they sort of are falling behind on these certain metrics. And so we really want to make sure that when schools are being assessed in terms of, how are they going to improve, what are the needs of students and teachers and the overall, population in the school, that health and wellness are being factored into that. There's also opportunities to, for professional development for teachers around health and wellness. And there's also opportunities within the transition from early childhood programs to elementary school. And finally, and this may be, one of the really big things within ESSA, is that the law defined what is considered a well-rounded education. And for the first time, health and physical education were included in the definition of a well-rounded education. So it offered the opportunity for states to potentially use some of this federal funding to support health and physical education. Next slide, please. Okay, and just to finish up, so we are talking right now about chronic absenteeism, and we're going to talk a little bit about the association between health and chronic absenteeism. We're also working on 2 additional webinars, one focusing on nutrition and physical activity and one focusing on mental health and wellness. And those will be additions to that framework document that we'll also roll out with the webinar, just like this one. And then I think that's my last slide. Next slide, please. Great, awesome. So I'm going to turn it back over to Alex to introduce Sue. Thanks so much.
Great, thanks, Nancy. So as Nancy did a great job setting the stage for today's webinar, we see the Every Student Succeeds Act as presenting some tremendous opportunities for supporting student health and school wellness. And really, one of those key opportunities is around how it creates a chance to support states and communities in addressing chronic absenteeism. And that's really what the meat of our webinar is going to dive into today. And so to start us off, we have Sue Fothergill from Attendance Works. Sue facilitates Attendance Works network to advance state attendance policy and practice, which is a network of more than 100 organizations from 31 states in the District of Columbia. Sue's also responsible for technical assistance at the local and state level and coordinates Attendance Works policy work at the state level. Prior to joining Attendance Works, Sue was the Director of Attendance and Related Strategies for the Family League of Baltimore and was the founding co-chair of the Baltimore Education Coalition, which successfully achieved $1 billion in school construction dollars from local and state sources for Baltimore City schools. I would just say Sue has been an incredible resource on the Every Student Succeeds Act and the opportunities it presents around chronic absenteeism. And she's going to start us off today with an overview of chronic absenteeism and then do a little bit of a deeper dive into some of those key levers ESSA presents for tackling this issue. So Sue, I will now hand it over to you.
Thank you, Alex, and thank you, Nancy. Attendance Works is so pleased to be here. Next slide. With you all, Attendance Works was established in 2010 to help to promote public awareness and political will to help to tackle and reduce chronic absence. We foster state campaigns, and we work at the local and state level to encourage improved attendance practice. Next slide, please. And so one of the things I want to make sure that we're all on the same page about is how we measure chronic absence. And so across the country, the majority of researchers who have been really looking at the relationship between lost instructional time and student achievement define chronic absence as when students are missing 10% or more of their days on roll for any reason, whether those days are of lost instructional time are due to excused reasons, such as health-related absences, unexcused absences, or suspension. Next slide. Chronic absence is different than average daily attendance, which is a measure that you may be more familiar with that tells us on average how many students showed up on any given day, or on average, how many students are showing up over time. What it doesn't tell us is how many students are missing enough school to be off track academically by missing 10% or more of their days on roll. Next slide. Chronic absence is also different than truancy, which is only a measure of which students are missing school for unexcused reasons. Notice the significant difference in students who were identified in Baltimore when accounting for missing 2 or more days a month for any reason versus only identifying students based on unexcused absences. You'll notice there's a significant difference across all populations of students, and then in particular in the early grades, we were able to identify many more students that were at risk based on their absenteeism. And on slide 16, you'll notice that it may be difficult to notice when a student is missing too much school because 10% of the school year is about 18 days of absence. And so in the next slide, you'll see in the calendar that while 18 days of absence may sound like a lot, when you break it down, it's just 2 days a month. And most parents don't get too stressed out if their children miss 2 days a month. And oftentimes schools don't have systems set up to be able to monitor and respond to and monitor when students or groups of students are missing this much school. In the next slide, you'll notice that across the country, the United States Department of Education, Office of Civil Rights, collected and released for the first time ever a nationwide data set on chronic absence. And what we found is that more than 6 million students were missing 15 or more days of school in the 13-14 school year, or about 1 out of 7 students. So this is a national challenge that we have to focus on and monitor. One of the opportunities with the passage of the Every Student Succeeds Act on the next slide and the addition of a school quality indicator is that meaningful attendance data is uniquely suited to meet the criteria for the accountability indicator. The indicator must be valid and reliable and able to be disaggregated across schools, districts, student subpopulations, and down to the individual student level. Because of the friendly nature of chronic absence and the ability to be able to monitor across student subpopulation and by individual student and the strong correlation to academic success that chronic absence represents, it's been a popular choice among states to use as a measure of school quality or as part of an index to measure school quality. In the next slide, we note that 13 plans have been submitted thus far to the United States Department of Ed. 8 plans specifically identify chronic absence as a measure of school quality, and 2 of the plans are looking to different types of attendance measures, with several more drafts that are including chronic absence as a measure of school quality. Next slide. And so when we think about chronic absence, and the research has shown that as a nation, next slide, we must acknowledge that frequent absences from schools can be devastating to a child's future. Research has shown that children who are chronically absent in preschool, kindergarten, or first grade are much less likely to read at grade level by 3rd grade. Students who cannot read at grade level by 3rd grade are 4 times more likely than proficient readers to drop out of high school. And by high school, chronic absence has been shown to be a better indicator of school dropouts than test scores. Next slide. Working to reduce chronic absence can serve as a unifying cross-cutting goal, an effective tool for determining where resources are needed, and as an easily understood measure of progress. Solving chronic absence, next slide, begins with identifying for your school or community what are the significant drivers behind absences. And of those, where are the opportunities to connect the relationship between student absenteeism and student social, emotional, and physical health? Next slide. Students come to school with baggage, and some of them have more significant burdens to bear. Solving chronic absence is about removing the barriers to learning and creating safe, supportive, and engaging environments. Next slide. In communities with concentrations of chronic absence and poverty, schools and communities must realize the widespread impact of trauma and design supportive environments that recognize that healing happens in healthy relationships. Next slide. Finally, as we think about chronic absence as a measure of accountability, and utilizing it in needs assessments and beyond, here's a framework to help to think about how to organize a systems-wide strategy. It is similar to a public health model and begins with prevention. The foundation of chronic absence prevention is creating a welcoming and engaging school environment. with strong site-based practices and approach to using data to coordinate and organize a multi-tiered system of support. Taking action in Tier 2 requires understanding the common causes of frequent absences among students and then developing, implementing, and monitoring prevention and intervention strategies. And when we do intensive work for Tier 3 kids, like coordinated case management approaches, it isn't enough without making sure they are welcome into school and have positive personalized support from people in the building. In many ways, it is our most vulnerable populations of students who might feel most alienated from school. The shift from truancy to chronic absence invites a holistic problem-solving approach, and addressing health-related absences requires a coordinated system of care. Health practitioners are uniquely suited to help schools and school districts transform their attendance strategies and make a difference for kids. And with that, I'll turn it back to you, Alex.
Great. Thank you so much, Sue, for that wonderful overview and for highlighting how we're already seeing states integrate chronic absenteeism into their ESSA accountability systems. So I wanted to just take a few minutes to highlight some additional levers within ESSA for addressing chronic absenteeism. But before I do that, I just wanted to ground us all and build off of what Sue shared around why chronic absenteeism is such an effective proxy measure for school health and wellness. So next slide, please. Just very quickly before I go into that, I wanted to give a background of the organization that I work for, which is Healthy Schools Campaign. For those of you who aren't familiar with us, we're a Chicago-based nonprofit, and all of our work focuses on a simple common sense notion that healthy students are better learners. And we work to make sure that the environment that students learn in, that staff work in, really supports the whole child and provides students with the conditions that they need to thrive. Next slide, please. So as far as what we know about this connection between attendance and health, research shows that there are a whole host of health conditions that are preventing students from getting to school, which is really why we have seen chronic absenteeism emerge as such an effective measure for student health and school wellness, because we know that very often the reasons why students aren't coming to school are health related. And granted, we know the reasons are very complex, but the data does show us that, really honing in on those health conditions can help really understand some of the underlying causes of attendance problems. The conditions that are listed here have been identified by Dr. Charles Bosch in a report that he issued called Healthier Students Are Better Learners, which really looked to highlight what are the leading health conditions for which there are significant disparities and for which we know there are proven school-based interventions for addressing those issues. So these health conditions listed here met those criteria and really have served for us as a highly effective framework of talking about the health conditions that kids are coming to school with. We know that 1 in 4 students are coming to school with health issues that can impact their attendance, and we also know that those health conditions, there are significant disparities within those health conditions. And so really when we look at the disparities we see within chronic absenteeism, it's especially important to think of those health-related causes. Next slide, please. And this next slide, just to highlight, is a chart which I really like and find a very effective way of representing the problem visually. National Association of School Nurses put this together, which just shows the prevalence of some of those leading health conditions. So we see that asthma, obesity, mental health issues are some of the conditions that really are impacting children in our nation's schools. Next slide, please. And just to underscore the connection between health and chronic absenteeism, I just wanted to share some of the data that is available. Asthma is one of the leading causes of chronic absenteeism and of missed school. We know that asthma accounts for 1/3 of missed school days, which is 10 million school days, which I just find staggering. We also know that children with persistent asthma are more than 3 times as likely to be chronically absent. So we know that this is a leading issue that is impacting kids' ability to get to school. Next slide, please. And another health issue that we know that is really impacting students' ability to attend school is oral health issues. And I think this is one that often surprises people and goes unnoticed. But especially in the younger years, this is a significant health issue that has a direct impact on attendance. 20% of children aged 5 to 11 years have at least one untreated decayed tooth. And again, we see those significant disparities playing out, and children with poor oral health are nearly 3 times more likely to miss school. Next slide. And so just one more kind of highlight of health conditions impacting attendance is mental health. And I think this is something that will resonate with anybody that spends their day in a school. Just there is a significant unmet need in terms of mental health issues impacting our nation's youth. Disorders including ADHD, depression, anxiety, and others disproportionately impact low-income minority youth. So again, really understanding that these health issues are things that students are dealing with on a daily basis that are having a direct impact on attendance is critical to understand. Next slide, please. The good news is, and this is what I mentioned earlier, is that we know there are best practices and proven interventions for supporting the conditions of health in school and in turn impacting chronic absenteeism. This chart, which actually Sue from Attendance Works put together, highlights some of those evidence-based interventions that we know work. So that is what we just want to underscore, is that this is an issue that there are proven solutions for, that with community engagement, with through partnerships with local health providers, with public health agencies, there really can be a lot of fantastic steps taken towards addressing this issue, which is why we also really see chronic absenteeism as a highly effective accountability measure within the Every Student Succeeds Act, because we know that there are things that can be done about it and that it can really create an opportunity for schools and communities and families to work together to turn this problem around. Next slide, please. And along those lines, Healthy Schools Campaign last year released a toolkit, which is a much deeper dive into what the leading health conditions are impacting attendance, looks at more of these school-based proven strategies for addressing the health-related causes of chronic absenteeism, and speaks to some of the partnerships that can really be leveraged in addressing those. So just the link is there to download this toolkit, but it's a great resource if you're interested in learning more about this issue. Next slide. And so I just wanted to bring us back again to the topic that we're doing the deep dive in today, which is the Every Student Succeeds Act. So as Nancy mentioned earlier, and as Sue went into, we see a number of tremendous opportunities for really catalyzing action around chronic absenteeism through this new law. Sue spoke about how it fits the core criteria outlined for an effective measure of school quality, which is a new requirement under the Every Student Succeeds Act. Two additional levers that we wanted to highlight today are around professional development and needs assessments. So next slide. In terms of needs assessments are required under the Every Student Succeeds Act, specifically for schools that are identified for targeted support and continuous improvement. And so these are schools that, for lack of a better word, are identified as underperforming by the accountability measures that are identified by the state through the law. So these schools that are identified for improvement are required to conduct a needs assessment to better understand why they might not be meeting those goals and in turn inform how they're using those resources and implementing programming to improve. And so I really want to underscore the importance of these needs assessments as a way of identifying those underlying causes of chronic absenteeism. And that's really what we have been kind of raising up through our work around the Every Student Succeeds Act, is that it's critical to, include those measures of school health and wellness, such as chronic absenteeism and accountability systems, but then really to make sure you're providing school districts and schools and communities with the tools they need to understand what those root causes are. And that's really where we see needs assessments coming in. And so we've been encouraging states to develop guidance around needs assessments and support the schools and school districts in conducting these in a way that really helps them dig into those underlying causes of the issues at hand. And so in terms of chronic absenteeism, there is data that a school district or school could access that could help them better understand those underlying causes. These are just some examples of the type of health data that they might already have available. Information about health status of students that's collected through health information cards that might be submitted at the beginning of the year, information that might be collected through school climate surveys, the YRBS survey, and other guidance and surveys that schools are already conducting. And so we've really been encouraging schools to look at the data that they already have. This is also where there's a tremendous role for partnership between the community and public health and health providers on the health front, and leveraging data that's already available to look at, what are the leading health conditions impacting this community. Next slide. And finally, the final lever we've highlighted for addressing chronic absenteeism through the Every Student Succeeds Act is around professional development. The new law really opens up tremendous flexibility in terms of how professional development funding can be used. Under No Child Left Behind, which was the previous iteration, professional development funding was really restricted to being used to training school staff around core academic competencies, and so training school staff around traditional academic subjects. The new Every Student Succeeds Act really broadens that and opens it, leaves it to the states essentially in terms of how they see fit to use that funding to train their school staff to be ready to support the needs of their students. This is one place in the law we specifically see chronic absenteeism called out. The law says that professional development funding can be used to train school staff to address how to address chronic absenteeism. And so that's just one example, of how that funding could be used. But we see that as a really important opportunity that, again, is up to the states in terms of how they implement it, but can be used in a way that can, train school staff around how to develop and implement early warning systems, multi-tiered systems of support, developing community engagement strategies for schools to engage parents and caregivers around the importance of attendance. It could be done around training custodial staff on how to create a healthy indoor environment. There's a ton of possibilities for really how this funding could be used to make sure school staff have the professional development they need to address chronic absenteeism. Next slide. I think that is it on my end, but just wanted to make sure. Great. So I will now hand it over to Lori Paisley, who's going to share some information about what has been happening in Tennessee. Lori is the Executive Director of Coordinated School Health at the Tennessee Department of Education. And prior to serving in this role, she served as the Director of Special Projects for the Deputy Commissioner of Education and the Office of Safe and Supportive Schools at the Tennessee Department of Education. Lori served as Coordinated School Health Supervisor for Putnam County Schools in Tennessee, where she was not only responsible for the 8 components of Coordinated School Health, but also served as 504 Compliance Specialist, homebound supervisor, school safety contact, as well as supervising over 70 employees in the areas of school counseling, school nursing, social work, and physical education. Lori was a special education consultant for her district for 6 years and was a special education teacher for 7 years. She started a system-wide program for students with severe psychological disorders for Putnam County Schools in 1996, and that program is still going strong. We're thrilled to have Lori with us today to share more about how Tennessee has thought about addressing chronic absenteeism through the opportunities that the Every Student Succeeds Act presents. So Lori, I will now hand it over to you. Lori, are you there?
Yes, sorry, my unmute
No
button
worries.
was not unmuted.
I should. Please, go
I
ahead,
think
Lori,
it was
take it
getting
away.
too long, it was stuck. Okay, thank you. Next slide, please. So here in Tennessee, as Alex said, next slide, please. We are very excited to have been able to include ESSA in our state name, and with the new logo that you see here, Tennessee Succeeds. And we really feel like ESSA or ESSA has given us an opportunity to build on the current successes that we have here in Tennessee. Next slide, please. And so on that note of success, with ESSA, we want to build on that success. And we firmly believe here in Tennessee in the strong evidence that student absenteeism truly does have a profound influence on academic outcomes, and that reducing chronic absenteeism will help improve the life outcomes for our students here in Tennessee. And we have some new measures for school quality and student success that were given to us by our stakeholders. So with those stakeholder perspective, they showed us that they had two key concerns: opportunity to learn and readiness for success after graduation. And we wanted to include our stakeholders because we feel like if we continue to engage our stakeholders, that creates a greater support and a greater understanding moving forward with this work. In opportunity to learn, that's where chronically out of school indicator is housed, if you will, and we are using the term chronically out of school, which I will explain later, but that indicator includes days missed due to out of school suspension as well, but we're continuing to explore disciplinary practices. And that chronically out of school indicator represents a measure that reflects the priority interest of the stakeholders that were engaged when we began the ESSA work. Next slide, please. So our district accountability areas are here on the slide. There are 6 areas. We have a grade banded success rate there, as you see, then your graduation rate and ready to graduate, and then English language proficiency assessment. But the one that we're highlighting here today is one of those 6, and that is chronically out of school. Our school districts will be assessed on these 6 performance areas, and then each of these 6 will be measured by 3 pathways. Next slide, please, which you will see on the next slide. The chronically out of school pathways are absolute performance, which gives us the % of students who are chronically absent in the district, or the AMO targets, and that's the target to reduce the % of students who are chronically absent in the district. The district is evaluated on the better of those 2 that you see there. So that's 50%, and with value added, and that's the student level comparison to measure the reduction in chronic absenteeism for specific students who were chronically absent in the prior year. And so that growth expectation is based on the current year state performance. So the first 2, absolute performance and AMO targets, they choose the better of those 2, and that'll be 50%, and then value added is 50% to give you a total of 100% in that performance area score. Next slide, please. So again, our indicator, chronically out of school, is intended to measure the amount of class time a student has with his or her teacher of record. I mentioned disciplinary practices, but also one thing that we really hit on in Tennessee is we appreciate and value our school nurses in our schools. Not all of our schools across the state have a school nurse, but we find that when a school has a school nurse, the student can be assessed, and if not having to go home, they can return to class. And we collect data on that, but this chronically out of school indicator is going to measure that amount of time that the student has with his or her teacher. Students who are absent or suspended out of school will be included in this indicator. Those serving an in-school suspension are not. This indicator will be weighted appropriately as a single metric and will encompass that chronic absenteeism and out-of-school suspensions. And for us here in Tennessee, a student is chronically absent if he or she misses 10% of the school year due to absences or out-of-school suspension. And a good example that I think Sue mentioned earlier is 18 or more days, and for us it's in a 180-day calendar. That would be the 10%. And again, we just firmly believe that students cannot learn if they are not in school. Next slide, please. So why is this chronically out of school indicator important to Tennessee? Well, we know that multiple research studies link poor attendance with reduced academic outcomes. And by only looking at average daily attendance rates, that tends to mask the attendance problems, particularly within subgroups. For us here in Tennessee, we're really focusing on students with disabilities, economically disadvantaged, and African American students. We know and believe that harmful effects of poor attendance are cumulative, and we also know that districts and schools have access to rich attendance data that can be monitored throughout the year. And we know that chronically missing school is an indication of conditions that can be successfully addressed. When I mentioned the particular subgroups, our data shows that the average of all students in all grades, their chronic absent rate is 14.8%. But yet economically disadvantaged is 19.2%, and then students with disabilities is 20.7%. So again, we want to focus more attention on those subgroups and get those kids attending school. Next slide, please. So why does it matter? Well, here in Tennessee, our students who are chronically absent in kindergarten are 15 percentage points less likely to reach proficiency in either third grade math or English language arts. And our students here in Tennessee who are chronically absent in ninth grade are 30 percentage points less likely to earn an on-time diploma. So that's 62% versus 92%. Next slide, please. So for us, the steps to address the root causes of chronic absenteeism are: step one, we want to redo the data. I mentioned earlier, we truly feel our districts and our school have rich data that can be monitored throughout the year. Step two is to identify the differences across schools. Even within one district, there may be differences across the schools within that district, and we want our districts to identify those differences. And then step three, unpack contributing factors, including health. Next slide, please. So that first step is reviewing the data, and here in Tennessee, our districts have student management systems that monitor attendance. They have student management systems that have discipline data. We have student family support services data, as well as student and parent focus group data. One thing that we want to remind everyone that they have right there at their fingertips is transportation and or other non-traditional sources of data. And then here in Tennessee, we are very proud to have coordinated school health and to be the only state to have coordinated school health in every school district. And we have a lot of data in that area, which I will be sharing later. Next slide, please. So that step two is identify differences across schools. This is an actual district in our state here in Tennessee, and we have data there on 4 of their elementary schools, and you can see the differences there. You can see that the average daily attendance rate is much different, as is the percentage of students who are chronically absent, and then the percentage of those economically disadvantaged students. So just by looking within your district at the differences across the schools within your district, you can really work toward doing next steps for each of those individual schools. And I think Alex was the one that mentioned the needs assessment. You can do that for a district, but you can also find that even 4 elementary schools within the same district have different needs. Next slide, please. So Sue spoke earlier about the drivers behind chronic absenteeism, which are included here again on my slide. What I've done here in step 3, where you unpack the contributing factors, These are more specific on what we really see here in Tennessee and what we hear from district leadership and from our schools. We hear a lot about unexcused versus excused absences, and our attendance supervisors, our attendance staff say many people here in Tennessee don't think excused absences are any type of problem, but when they really start to add up, they are. Obviously, people look at the unexcused absences. And then we're looking at sporadic versus consecutive absences. I believe Sue's calendar slide really talks about that, and we see a lot of that here in Tennessee. With avoidance, we see a lot of social avoidance, and if students don't feel safe at school, you see some absences in that area, as well as academic struggles, their school safety and bullying. We're working very hard on that in Tennessee, as well as what I mentioned earlier about disciplinary practices. Students have family issues, possibly undiagnosed disabilities. And I know Alex, Sue, and Nancy all either mentioned or directed towards school climate and relationships. Strong relationships are needed for our students to feel connected and engaged in schools. And then last, with health, and Alex talked a lot about the leading health conditions impacting attendance earlier, and our coordinated school health coordinators each write an action plan for every district here in Tennessee that have a goal around at least one of those health disparities. So here in Tennessee, we know that contributing factor is very strong. Next slide, please. And so on that note, health, whether it's physical or mental, plays a part in chronic absenteeism. And I mentioned earlier, we have a lot of rich coordinated school health data here in this state. And we have data, our most current data is from the school year 2015-16. And in that school year, there were 3,885,680 student visits to a school nurse, and 87% of those visits resulted in a student's ability to return to class instead of being sent home. In that same school year, 205,254 students had a chronic illness or disability diagnosis, and that's 21% of all of our students statewide. Between 2004 and 2005 and 2015-16, the total number of students with chronic illnesses or disability diagnoses increased by 236%. In Tennessee, in 2015-16, the most common chronic illnesses were asthma, coming in at number 1, ADD and ADHD in second place, and then severe allergies. And you see the breakdown there on the slide, but with asthma being number 1, next slide please, I would like to share a local asthma success story. Really at the local level in our districts, this is what we're seeing in the area of asthma across the state. Again, we have a coordinated school health coordinator in each district. Many of them have partnered with the local asthma care clinic, which that clinic was able to perform PFTs, for those of you who don't know, pulmonary function test. And then they were able to give professional development opportunities related to asthma to schools, to district staff, and to give them resources. They worked with the school nurses to ensure all students diagnosed with asthma have an asthma action management plan. And after this, we found that more inhalers were brought to the nurses following the screenings. Those school nurses had tangible data to be able to address symptoms, and then those screenings exhibited the importance of asthma education for those school districts. Next slide, please, and that is my final slide, so I will turn it back over to Alex.
Great. Thank you so much, Lori. I really appreciate you sharing that additional information about Tennessee, and I think it's particularly interesting the insights that you share about, how understanding asthma as a leading problem within your school districts, how that catalyzed action, and I think that's the type of action that we're really hoping, including chronic absenteeism as an accountability measure and driving action around that can have. So thank you for sharing that case study. So we are now going to take the final 10 minutes or so of our webinar to answer your questions. So if you have a question, please feel free to chat it in through the questions box. I'll give people a minute to do that. And we'll just say, as Nancy mentioned, Healthy Schools Campaign, the Alliance for Healthier Generation, and Attendance Works are going to be releasing a addendum to the bigger framework Nancy mentioned around opportunities for supporting health and wellness through ESSA. And the addendum is going to focus specifically on the content we've talked about today on how ESSA can be used to address chronic absenteeism. So we'll be including a link to that addendum in the follow-up email you get as a part of this webinar, and encourage you to check it out. So we'll go ahead and get started with questions. So the first one came in, it was specifically for Sue, but I think Lori, you probably will have insight to add as well. It's wanting to know about rural areas. So specifically wanting to know if chronic absenteeism disproportionately hits rural areas, and if addressing chronic absenteeism is different in rural areas. So Sue, is that something you might be able to share kind of higher level insight on, and Lori, maybe you can speak to how that plays out in Tennessee. So Sue, can we start with you?
Yes, absolutely. And so the answer is there is disproportionality in the data across the country, and one of the concentrations of chronic absence that we found looking at the OCR data was that there were certain rural areas that had higher than average rates of chronic absence. And so if you recall, I said 1 out of 7, sort of the national norm. And then there are certain rural areas with higher concentrations of more than 1 out of 10 students who are chronically absent. And so while there may be fewer students affected as compared to, say, a larger urban district, when you look at the concentration, it's a significant issue. And then there are differences that relate both to why students are missing school, and then also to then, therefore, what are the possible strategies. And so some of the challenges we've seen in rural communities, and I work more closely in rural communities in Arkansas and Kentucky, has to do in part with transportation. And so if you live pretty significantly far from the school and you miss that bus, then it becomes much more challenging to find an alternative way to get to school, are part of the challenges. And then there's community suffering from depression and sort of questionable opportunities beyond high school. And so dealing with the hopes and dreams of students and families about the opportunities for their future becomes a significant issue as well, another challenge that families are experiencing. And then also just, some cultural realities of schooling, even just, 2 decades ago, when you left school and what the opportunities were post-education, and at what grade you could find success in different kinds of work versus where communities are now, especially in rural communities where disinvestment has happened and jobs have moved away. There's a significant shift in what that looks like, and part of what we have to do as part of that is communicate the importance of staying in school through high school and then beyond to help to provide students with pathways to career and college. And I'll turn it over to Lori.
Thank you. Here in Tennessee, the majority of our state is rural. So really out of 140 plus districts, we really only have 4 large urban school districts. So the majority of our state is rural, and what we find is, as a state, and really what I shared with our plan, we're really looking at the next steps and moving forward to be consistent for all of our school districts. But we also know and recognize that rural districts may not have the same community resources as some of the larger urban districts. And so we're really working with a lot of our state partners. I know with Coordinated School Health, every one of our counties has a county health department. So we try to tap into those resources, but really we don't have a lot of data on what is going on in the rural districts as far as chronic absenteeism, but we're going to move forward with that. But what we've seen with Coordinated School Health Services, support for all of our rural districts is the community resources aren't there. But as Sue said, a lot of this is with economic development, and we're working right now with one of our governor's initiatives on adverse childhood experiences with ACEs, and we're working with one very impoverished, very rural district, and economic development is working to make connections to provide more jobs, but yet we know that isn't going to solve all the problems for that particular rural district. But many of those students, as Sue mentioned, there's transportation issues, and we also find that some of our students, particularly in the high school years, may be dropping out of school to get jobs to help support their families. So those are some of the things that we're seeing in our rural district. However, when we move forward and taking those next steps, we're trying really hard to be consistent across the board with all of our school districts, regardless of where they are, and providing support and resources no matter how rural the district is.
Great. Thank you both for sharing your input on that question. So the next question is for Lori, and I think this is probably a quick one, but somebody wanting to know if you have a school nurse in every school building in Tennessee, and if not, just if you have any insight on, what if the student to school nurse ratio, or just what that coverage is instead.
So we do not have a school nurse in every school, and many of our nurses with the ratio, we may have a nurse that covers 3 schools. We have a BEP funding recommendation for school nurses here, and we had legislation proposed this year to increase that funding in order to have a school nurse in every school, but it had a pretty high fiscal note and did not make it very far. But we do not have a school nurse at every school, and it really varies from district to district. In my former district, we were fortunate enough to have a school nurse in every school, and we have many districts who do. However, the majority of our districts may have a nurse covering multiple schools during the day.
Great, thank you. Another question for Lori, which might actually be able to add some additional input on, is in addition to coordinating with school nurses and other school-sponsored health, is Tennessee coordinating with any of their local nonprofit hospitals to meet health needs? So actually, Lori, while you think about that question, I will just add that I know outside of Tennessee, there are some great examples of partnerships between hospitals and school districts, specifically to meet the nonprofit requirement for hospitals to provide benefit back to the community, so the community benefit requirement. So a couple that come to mind are Spectrum Health in Grand Rapids, Michigan has a partnership with the school district there to put a school nurse in their schools. In Austin, Dell Children's is working with Austin School District, again, around increasing access to healthcare providers. And another good example we highlight is Toledo Public Schools. They have a partnership there with ProMedica to put a full-time school nurse in every school. So there certainly are those bright spots. It's by no means the norm, or at least that's what we've seen. But there are some great examples of those types of partnerships happening. So Lori, I don't know if you are able to speak to any specific partnerships that have taken place in Tennessee.
Yes, we have many areas where regional hospitals are providing school nurses and health services. They are providing school nurses, and some are providing mobile health units, mobile clinics. Some of those provide just immunizations. Others are doing well child exams. Those typically do, related back to that rural question, those typically do reside in the larger, not necessarily always urban, but more metropolitan areas. But for one example, we have St. Thomas Rutherford Health, which is in Rutherford County in Tennessee and is currently working with the 2 school districts that are in Rutherford County, but they have also bought out some community hospitals in 4 other counties. And I have personally connected at least one person, usually 2 from that organization, with our coordinated school health coordinator in those 4 other counties, and they are building those partnerships. So we're finding a lot of regional hospitals, regional healthcare organizations that are within a region reaching out to, through our coordinators, to schools and school districts to provide many services. Some of those provide grants for walking tracks, so it's not just providing a nurse or a school-based health clinic or even a mobile health unit, but it's really sitting down and, as Alex mentioned, helping and being a part of that needs assessment to see what that particular community and school district needs, and they're providing those resources.
Great. Thank you so much, Lori. So I know we are a minute over the hour, so want to be respectful of people's time and wrap up the webinar. I know there are a handful of questions we were not able to get to, so we will be sure to follow up with you with those questions offline. So if you think of any other questions, feel free to type them in. We'll be sure to follow up. And just wanted to say thank you once again to our speakers, to Nancy, to Lori, to Sue. We really appreciate you taking the time to join us on the webinar, and to all of our participants, thank you for listening in today. And we will be sending out a link to the recording of the webinar and the slides, in addition to a link to the document I mentioned, which goes into detail about the opportunities ESSA presents for addressing chronic absenteeism. So thank you, everybody, and enjoy the rest of your day.